Hi, my name is Haley Godwin, and I'm a third-year medical student at the University of Utah. I'm speaking to you today about our research on emergency department airway management for status asthmaticus with respiratory failure. We have no conflicts of interest to disclose. Current data shows that more than 25 million Americans are living with asthma. Worldwide, more than 45% of asthmatics experience at least one asthma attack per year, with asthmatic attacks accounting for more than 10% of emergency department visits and over 4,000 deaths. While there is adequate research on incidence, prevalence, and mortality of asthma, data regarding current practices and outcomes for emergency department airway management of status asthmaticus is extremely limited. Thus, in our research, we ask what are the methods used and outcomes for airway management in emergency department patients requiring intubation for status asthmaticus. We gathered our data using the National Emergency Airway Registry, also known as the NEAR database. The NEAR project is a multi-center registry comprising of 25 different emergency departments across the U.S. We analyzed all intubations with a primary indication of asthma over a 3-year period. In this presentation, we report the incidence of intubations for asthma, methods and medications used, adverse events, and intubation success and failure rates. A total of 19,071 intubations were recorded during the study period. Of these, 14,517 intubations were medically indicated, i.e., we excluded all traumatic intubations. Of the medically indicated intubations, 173, or 1.2%, were asthmatic intubations. First attempt success rate was 90.8%, with an overall success rate of 100%. The adverse event rate was 12.1%, with hypoxia and hypotension being the most common adverse events. In our first figure, you can see the comparison of pre-oxygenation methods in non-asthmatic versus asthmatic intubations. Approximately 2/3 of asthmatic patients with a reported method of pre-oxygenation were pre-oxygenated with bi-level positive airway pressure, also known as BPAP. This is compared to the majority of non-asthmatic intubations using non-rebreather face masks for pre-oxygenation. Of note, it is unclear if the rate of pre-oxygenation with BPAP in the asthmatic population indicates its routine use as a first-line treatment, or if it was a deliberate decision by providers to achieve pre-oxygenation in preparation of intubation. Here we can see the comparison of method of intubation in non-asthmatic versus asthmatic patients. The rate of rapid sequence intubation, also known as RSI, in the asthmatic population was significantly higher than the rate of RSI in the general population. The percentage of patients with any difficult airway characteristic was higher in the general population when compared to those with asthma. This lower rate of anatomic difficulty and the need to achieve successful intubation promptly in the context of rapid oxyhemoglobin desaturation likely explains the higher rate of RSI use in the asthmatic population. In this figure, we can see the comparison of induction agent in non-asthmatic versus asthmatic patients. The use of ketamine as an induction agent in the asthmatic population was significantly higher than the general population, likely due to ketamine's documented bronchodilatory effects. Meanwhile, etomidate was by and far used most often in the general population. After multivariable regression, controlling for variables that impact first attempt success in emergency department intubations, we found no difference in first attempt success between etomidate and ketamine in the asthmatic population, suggesting that either drug is appropriate in this population. We found no significant difference in paralytic agent when comparing non-asthmatic versus asthmatic intubations. As you can see here, succinylcholine and rocuronium were used at nearly equal rates in both populations. To review, there was an overall adverse event rate of 12.1% in the asthmatic population, with hypoxia and hypotension being the most common adverse events. Of interest, no barotrauma events were recorded, though we do not have data on asthmatic patients once they leave the emergency department. First attempt success rate was 90.8%, with an overall success rate of 100%. First attempt success, ultimate intubation success, and the adverse event rate in the asthmatic population was quite similar to that of the general population. Some limitations to this study include potential bias from recall and self-reporting. In conclusion, status asthmaticus accounts for only 1% of intubations performed for medical indications in the emergency department. Most patients requiring intubation for asthma are intubated using rapid sequence intubation after pre-oxygenation with BPAP and induction with ketamine. These practices differentiate asthmatic intubation from other medically indicated intubations. Overall intubation success rate in this population is 100%, indicating that the above method is an effective approach to emergent asthmatic intubation. Here are our references. Thank you so much for listening, and thanks in particular to Drs. Fix, Brown, Baker, and Madsen.